Before we talk about when is the right time to wear gloves, it's important to make two key points. Firstly, gloves should only be used when they are really needed following your risk assessment at a moment in time. Secondly, gloves are not a substitute for hand hygiene. Glove use must be coupled with appropriate and timely hand hygiene to prevent the spread of infection between patients and staff. Health and care workers should wash their hands or use hand sanitizer, ensuring that hands are dry before putting on another pair of gloves if required. Hand hygiene should never be performed whilst wearing gloves. More about hand hygiene will follow in a short while. There are a set of measures called standard infection control precautions that are considered necessary to reduce the risk of transmitting infection from both known and unknown sources. Gloves are a core component of personal protective equipment, or PPE, which should be used when there is any likely exposure to sources of infection to you. These include, for example, blood and other body fluids, secretions or excretions, non-intact skin or mucous membranes, and the care environment in some circumstances. It's important to remember that gloves must also be worn when you expect contact with harmful chemicals and drugs. This could include disinfectants, preserving chemicals, chemotherapy drugs, and potentially treatments for alopecia. This pyramid, produced by the World Health Organization, provides more detail on when and when not to wear gloves, as well as what type of glove to wear. The bottom section of the pyramid shows when there is no requirement to wear gloves of any type and hand hygiene activities are quite safe. The middle section indicates when we should wear gloves, and the top section shows when sterile gloves should be worn. You've had a lot of information so far, so let's try a few quick scenarios for you to think about. Would you wear gloves to wash a patient, remove a urinary catheter, give a vaccination, help someone to eat or drink, or to help transfer a person from a bed to a chair?